COVID cases continue to spread throughout the inland Northwest, and in North Idaho alone, there have been 151 new cases and 125 people are currently in the hospital. In Spokane, there were 831 new cases over the weekend. COVID hospitalizations are starting to dip, with 221 people currently in the hospital. But the number of COVID deaths are on the rise, with 23 people dying of COVID last week alone. Both Providence Sacred Heart and Multicare medical centers have had to cancel elective surgeries. They say they still have room to take care of the sickest patients. Vanessa Perez is live with what you need to know.
Despite hospitalizations being down across the state, it's not the same story here at Providence Medical Center. They're seeing a record number of COVID admissions. 30 people have died of COVID in Washington in the last 24 hours. Here at Providence, they're so packed, serious surgeries like spine surgery and cancer operations have been canceled or postponed to make more room. That room is for very sick patients.
We want people to realize that if you're really, really sick, we can care for you right now. We want you to come to the emergency department with your heart attacks and your strokes. And that was something that really worried us when we initially saw people too scared to come to the hospitals. We have capacity care for the sickest of the sick. In the meantime, we're still pausing those patients that have very real problems that we can take care of.
Mortality rate is roughly 30 to 50% when a patient is put on a ventilator at Providence. Dr. Getz calls the ventilator kind of like the Hail Mary of COVID care.
It's an agonizingly long process, and it really makes it challenging to move patients through an ICU. We had Sacred Heart at 54-bed ICU, and it's not been uncommon to see 20-plus patients in that ICU with COVID, many of whom are intubated and prone.
Dr. Getz says the community needs to step up and get vaccinated. He says Eastern Washington is in worse shape than the West Side because of lower vaccination rates.
It really is. It's just incredibly difficult to do. The amount of care that a sick COVID patient requires is just incredibly large. And again, it highlights the importance that this is largely preventable. The vast majority of these patients should not be in hospitals if they were vaccinated. Almost never do we see a vaccinated patient on a ventilator for COVID.
Doctors here say the vast majority of these patients should not be in the hospital had they been vaccinated. Reporting live in Spokane, Vanessa Perez, 4 News Now.